You think PTSD is only for veterans? Trauma affects all kinds of men, and most don't talk about it. Post-traumatic stress disorder isn't just from war. It can be from car accidents, violence, abuse, and even medical trauma can trigger PTSD. Some symptoms in men include flashbacks and nightmares. They go to bed at night and they hardly sleep because of dreams associated with that trauma or event that caused PTSD. Or they sit back and they're kind of zoned out because they have flashbacks and it looks so real and it can be really stressful. Their emotions begin to numb. They begin to experience emotional shutdown because they're in distress. How about explosive anger or aggression, especially during periods when they are hypervigilant? They are constantly trying to do things to help them forget whatever will remind them of that trauma or that experience. And that can include self-medicating with alcohol and drugs. Remember that in PTSD, the incident or the trauma does not have to happen to you directly. It could be an experience, or you might have witnessed somebody else undergo significantly trauma enough to disturb you and cause PTSD, or it is a direct experience that you experienced yourself. And let's talk about some barriers consistent with men when it has to do with seeking help. Stigma is a big deal. It's a big barrier associated with seeking help. There's the stigma around vulnerability. Some men have difficulty being vulnerable. Mislabeling symptoms as bad attitude. These individuals have limited access to trauma-informed care. They are not educated. They don't even understand what is going on with. Therapy do work. There's EMDR. There's trauma-focused cognitive behavioral therapy or group therapy. We also have peer support, especially amongst veterans. So if you know a man who's been through something heavy, PTSD is real and healing is possible.